report you're publishing today, and why have you chosen to publish it?
So our report out today is Who Cares? The Future of General Practice. We think general practice is critical for the NHS for lots of reasons. First off, the average person uses general practice 6 times a year, and the NHS must also find £22 billion worth of funding efficiencies by 2020-21. Now, we looked into general practice as it stands today, and we found that the 1948 model still fundamentally remains, which causes problems for patients. So, for instance, everyone will recognise that access is a key problem, which drives lots of people into A&E and hospital unnecessarily.
And so, in a nutshell, what are your kind of headline recommendations?
So we're saying we need a whole new model of care in general practice. We're saying providers should deliver what's known as a population health approach, which is a more proactive approach to delivering care in the community. It means focusing on prevention, for instance. We think that providers should embrace technology, they should have a more diverse workforce, and they should operate at scale to be able to deliver this care.
So you've mentioned there the role of technology. What exactly is it that you're saying about that in the report?
So technology can be used in 2 different ways. The first is when patients try and book appointments, for instance. The government has aimed to roll this out across the country, but only around 7% of people use this booking facility. But we see when it is used that huge efficiency savings can be made, so people can be signposted to self-care when they actually don't need to see a GP, so it avoids them going into care. And secondly, the way that appointments are delivered can be revolutionised by technology. So general practitioners can use video appointments, for instance, which are about 40% quicker than your average face-to-face appointment.
So the second recommendation that you mentioned was around a more diverse workforce. Are you saying that people shouldn't go in and when they make an appointment they get to see a GP?
So we're saying the current system is built around the GP and not the patient. Currently 370 million appointments are conducted in general practices. We understand that around 2/3 of those appointments are delivered by GPs, but the expert stakeholders we interviewed in the research for the paper suggested that 50% of those appointments could be delivered by other clinicians. Now, if you just take one set of appointments, which is minor ailments alone, that's about 57 million appointments. We say if other clinicians such as pharmacists or nurses deliver those appointments instead of GPs, then the NHS will save over £700 million a year.
So the third recommendation you mentioned was around scale. What do you mean by that?
So currently general practice is very, very small. The average practice has around 7,500 patients. But we're seeing across the globe that actually the best providers operate at significantly larger scale. So across the UK, providers have over 100,000 patients in some cases. And in the States, one provider has over 10 million patients. Now what this means is that these providers can build the infrastructure to deliver extended care services to their patients. They also have the ability to invest in prevention measures and also invest in technology when they're delivered at such scale.
So let's say in 5 years' time I need to make an appointment to go and see my GP. What would it look like then?
So who's to say you'll even turn up at your surgery? It's been estimated that around 1/5 of GP appointments are consumed by the worried well, and we're saying if you use technology then these patients can be pointed to self-care. But should you need to turn up, we envisage a really radical change. So far more services will be on offer. So diagnostic services, for instance, you'll be able to get an X-ray at your GP surgery. And also if you need urgent care, then larger GP practices can deliver urgent care. And in fact, they are doing so in some places in the country. Lakeside Healthcare in Northamptonshire provides urgent care services for its 200,000 patients. That's delivered at 1/3 of the cost of an A&E. And we estimate that if that was rolled across the country, that would save £1.1 billion for the NHS.
So you've obviously got a lot of recommendations in your report. You want to see quite a dramatically different model of general practice, primary care. What's your message to government?
So we think that ministers must act if they want to see this change. GPs are currently contracted by the state to provide healthcare services. They have been since 1948. But contracts as they stand are essentially open-ended. We are calling for more competition in contracts, so they're time limited. so that can make the most of the growing number of providers that are operating in these markets now. We're also calling for commissioners to focus on outcomes that matter to patients rather than looking at inputs or processes which become very bureaucratic and depersonalising. And we're also calling for the government to scrap its target to employ 5,000 more GPs, because we think that a more diverse workforce and a better use of technology can meet patient needs more effectively.